Welcome to My channel. Saudi Physiotherapy License Exam. Most important questions and answers. To decrease load on medial aspect of knee. A. Lateral heel wedge. B. Soft knee splint. C. Strength extensor. Tool provide physiotherapists with visual and auditory signals to monitor MS recovery. A. Biofeedback. B. EMG. Postnatal diastasis recti, the most effective diagnosis method? A. MRI, B. CT scan, C. Ultrasound, D. Finger examination. During weight bearing, a soft tissue contracture resulting in supination of the forefoot will be compensated by A. Pronation of forefoot, B. Pronation of rear foot, C. Supination of rear foot, D. Pronation of rear forefoot. Which of the following muscles has least effect in Q angle? A. Lateral retinaculum, B. Biceps femoris, C. Quadriceps, D. Tibialis anterior. During shoulder elevation, rotator cuff muscles pull humerus head down to prevent impingement, and most active muscles of that pull are infraspine of scapula muscles. Which of the following has the greatest percentage composition of type 1 slow twitch fibers? A. Gastrocnemius, B. Supraspinatus, C. Biceps brachii, D. Biceps femoris. Which muscle using in climbing upstairs go up incline? A. Hamstring, B. Soles, C. Quadriceps, D. Ankle plantar flexors. Diabetic patient cannot brush hair. What is that according to ICF model? A. Impairment. B. Personal factor. C. Activity limitation. ACL injury most common from hyperextension then twisting. Spina bifida is characterized by A. Unclosure pia mater. B. Hyperextension of knee joint. C. Lateral curvature of the spine. D. Unclosure of pia mater. Patient with groin pain 2 weeks ago use A. Pulsed ultrasound. B. Continuous plus interferential. Bilateral weak knees of that muscle make you need crutches. A. Tensor fascia lata. B. Gluteus maximus. C. Gluteus medius. D. Hamstring. What is the main aim of ICF? A. Impairment. B. Activity limitation. C. Participation. Apex of the heart at fifth intercostal space near mid-clavicular line, 9 centimeters from midline. Borg scale is used to measure A. Pain, B. Dyspnea, C. Muscle strength, D. Balance. Cortisone long-term use make the weakness in blood vessels and cause bleeding. Which breathing technique improve oxygenation and reduces dyspnea? A. Diaphragmatic breathing, B. Pursed lip breathing, C. Segmental breathing, D. Glossopharyngeal breathing. DEXA for osteoporosis. 1 and above is normal. 1 to minus 2.5 osteopenia. Minus 2.5 and below osteoporosis. Osteoblast, a cell which secretes the substance of bone. Spasticity is velocity dependent. Increase in tone seen in LMN lesion, BUMN lesion, C. Peripheral neuropathy, D. Myopathy. Claudication pain which increase with walking and stop with rest due to peripheral arterial disease. Frozen shoulder mainly affects which movement first? A. Flexion, B. Extension, C. External rotation, D. Internal rotation. Child can walk on tiptoe age 3 to 5 years. McMurray test is used to diagnose A. ACL tear, B. Meniscus injury, C. MCL injury, D. Patellar instability. Gastrocnemius has more fast twitch fibers and it is easily fatigued. A COPD patient should be trained in A. Rapid breathing, breath holding, C. pursed lip breathing, D. hyperventilation. Raynaud's disease? It is a condition in which the small blood vessels of the fingers and toes overreact to cold temperature or stress, causing temporary changes in blood flow. At any age, baby can differ between family and stranger as 6 months, B 7 months, C 8 months. Balance, ability to stay upright or stay in control of body movement. Don't use heat modalities in hemophilia and malignant dot tumor. Which negative factor you treat if you increase strength of muscle and range of motion? A. Personal factor. B. Activity limitation. C. Impairments. To recover power from atrophy, muscle needs 2 to 3 months. Therapists should consider using a dot form of treatment other than dot moist heat application on the dot posterior lumbar region of all dot of the following patients except A. Patient with a history of hemophilia. B. Patient with a history of malignant cancer under the site of heat application. C. Patient with a history of Raynaud's phenomenon. D. Patient with a history including many years of steroid therapy. Endurance? It is the ability of muscle or muscle group to sustain repeated contractions against resistance for extended period of time. SWD uses frequency 27.12 megahertz and wavelength of 11 meters and doesn't stimulate motor or sensory nerves or produce muscle contraction. Duration of session is 20 minutes. A patient with L4 L5 disc prolapse will have pain radiating to A. Anterior thigh, B. Posterior thigh, C. Lateral leg and dorsum of foot, D. Medial leg. Flexion extension in sagittal plane, adduction in coronal plane, internal and external rotation in transverse plane. Most common fracture in elderly due to fall: A. Humerus, B. femur neck, C. tibia, D. radius. We use ultrasound pulsed in dot strain, inflammation, and to dot promote healing, we use continuous to make heating and decrease dot muscle spasm. Strength grading 3/5 means A. Full ROM against gravity, B. Full ROM without gravity, C. No contraction, D. Flicker contraction. Osteoclast, a large multinucleate bone cell which absorbs bone tissue during dot growth and healing. Which reflex persists abnormally in cerebral palsy? A. Rooting reflex, B. Moro reflex, C. Primitive reflexes, D. Babinski reflex. Baby can recognize family that from 3 to 4 months and the differentiate between them at 0.6 to 8 months. Closed chain exercise example: A. Leg extension, B. Biceps curl, C. Squat, D. Shoulder abduction. For knee stability, we exercise the quadriceps. Contraindication of ultrasound therapy: A. Muscle spasm, bend, tendinitis, cancer, malignancy, D. Joint stiffness. HVPG stimulation for DINNEVATED muscle. Delayed onset muscle soreness occurs after A. Isometric exercise, B. Concentric exercise, C. Eccentric exercise, D. Passive stretching. Impingement, shoulder abduction from 0.60 to 120 degree. Which current is used for muscle re-education? A. TENS, B. IFT, C. Faradic current, D. Galvanic current. Acromioclavicular joint problem from 170 to 180 degree. Normal oxygen saturation is A. 80 to 85%, B. 85 to 90%, C. 95 to 100%, D. 100 to 110%. For knee stability, we dot exercise quadriceps. Ankylosing spondylitis, we dot focus on posture. In spinal cord injuries, do push dot up to relieve pressure every 0.15 to 20 minutes. To decrease edema, we use dot galvanic current then, faradic current. Thanks for watching.